If you're over 60 and you've been taking vitamin B12 every single day, but you're still feeling exhausted, still dealing with that brain fog that just won't lift, still noticing tingling or numbness in your hands and feet, then I need you to hear what I'm about to share. Because there's a very good chance the problem isn't that B12 doesn't work for you. The problem is that the way most people over 60 are taking it is actually preventing it from working at all. I'm Dr. Michael Kent, and in over 2 decades of practice, I've had this exact conversation with hundreds of patients who were doing everything they thought was right and still getting worse. And I'll be completely straight with you. What most doctors tell patients about B12 and what most patients believe about it is missing some critical pieces. By the end of this video, you're going to understand why your supplement may not be reaching your nerves and brain the way you think it is, what the real barriers are, and the specific step-by-step changes that make an actual difference. Now, before we go any further, do me a quick favor. Hit that subscribe button right now and drop a comment below telling me your age and where you're watching from. Tell me if you're currently taking B12 and still dealing with fatigue, brain fog, or nerve symptoms. I read every comment, and your experience genuinely helps other people in our community find the answers they need. That one comment takes less than 30 seconds, and it could make a real difference for someone else watching this. All right, let's get into it. Here's something that surprises almost every patient I tell it to. You can have a completely normal B12 level on a standard blood test and still have nerves and brain tissue that are not getting what they need. I know that sounds like it shouldn't be possible, so let me explain why it happens. Vitamin B12 is essential for 3 things that matter enormously as you get older: your nerve function, your brain health, and your energy metabolism at the cellular level. Without enough usable B12 actually reaching your cells, nerves begin to malfunction slowly and silently. That's why the early symptoms are things like tingling and burning in the hands and feet, trouble with balance, fatigue that a full night of sleep doesn't fix, and that deeply frustrating brain fog where words disappear mid-sentence and you lose your train of thought without warning. Now here's the core problem, and it's one that builds gradually with age. As we get older, our ability to actually absorb B12 from supplements and food drops significantly. By age 60, research suggests that more than half of adults have reduced stomach acid production. And stomach acid isn't just for breaking down food. It's absolutely required to separate B12 from a supplement so your body can even begin to process it. On top of that, your stomach lining produces less of a protein called intrinsic factor as you age. Intrinsic factor acts like a dedicated escort for B12. It binds to it and carries it through your intestinal wall and into your bloodstream. Without enough intrinsic factor, swallowed B12 largely passes through your system without being absorbed. Less stomach acid plus less intrinsic factor is a combination that means a lot of the B12 you're faithfully taking every morning is simply not getting in. And here's what makes this particularly frustrating. Your blood test can still come back looking perfectly normal. That's because standard B12 blood tests measure how much is circulating in your bloodstream, not how much is actually entering your nerve cells and brain tissue. A patient can have an acceptable number on paper while their nerves are quietly being starved of what they need. This is why so many seniors take B12 conscientiously for years and feel absolutely nothing change. The supplement is technically there. It's just not arriving where it matters. I want to tell you about one of my patients. Let's call him Raymond. Raymond was 76 years old, a retired firefighter, sharp, disciplined, not someone who ignored his health. He'd been taking B12 every single morning for almost 4 years, ever since his doctor recommended it when his energy started declining. And for those 4 years, his B12 blood levels had looked acceptable every time they checked. Normal range, nothing alarming on paper, but Raymond kept getting worse. His balance had deteriorated to the point where his wife had quietly started walking close behind him on stairs, not saying anything, just positioning herself to catch him if he stumbled. He'd given up his evening walks around the neighborhood because he didn't trust his footing on uneven pavement anymore. And the brain fog, he described it to me as trying to think through wet concrete. Words he'd known his whole life would just vanish. He'd stop mid-sentence and have no idea where he was going with it. Every doctor he'd seen over those 4 years pointed to the blood test and said the same thing: "Your B12 looks fine." When Raymond came to see me, I ordered a more complete evaluation, specifically methylmalonic acid and homocysteine levels. These markers give us a much better picture of whether B12 is actually functioning at the cellular level, not just floating in the blood. Both came back elevated. His cells were not getting usable B12 despite the blood test looking acceptable. When we went through his daily routine in detail, the problem became clear very quickly. Raymond was taking cyanocobalamin, the cheapest and most common form of B12 sold in pharmacies, as a standard swallowed tablet every morning, right at the same time as his metformin for blood sugar management. Three separate problems stacked directly on top of each other, each one quietly undermining his efforts. We made targeted changes to his protocol, switching the form, switching the delivery method, and adjusting the timing relative to his medication. Within about 6 weeks, Raymond told me the heaviness in his legs felt slightly less constant. After 3 months, he said he'd started his evening walks again. Short ones at first, but he was out there. After 5 months, his wife pulled me aside at a follow-up and said, with her voice catching just a little, "He's back." That kind of story is not rare in my practice. I've seen versions of it many times over, and every single time the issue wasn't that the person wasn't trying, it was that nobody had explained the difference between taking a B12 supplement and actually getting B12 to work inside an aging body. So let's go through exactly what goes wrong. The first and most common problem is the form of B12 itself. Walk into any pharmacy or grocery store and pick up a B12 supplement off the shelf. Almost certainly what you're holding is cyanocobalamin. It's inexpensive to manufacture, it's chemically stable, and it dominates the supplement market. But here's the critical issue. Cyanocobalamin is a synthetic form that your body has to convert into active B12 before it can do anything at all. That conversion process requires healthy liver enzyme function and adequate antioxidant capacity. Both of those tend to slow down meaningfully as we age. So in a 70 or 75-year-old body, you're handing your system a raw material that needs to be processed by a factory that's running at reduced capacity. The active forms, methylcobalamin and adenosylcobalamin, skip that conversion entirely. Your body can use them immediately, as is. That difference is enormous for older adults, and it's the reason why many patients who switch forms start noticing improvements they hadn't seen in years of taking the other kind. The second problem is the delivery method. When you swallow a standard B12 tablet or capsule, you're completely dependent on your digestive system working correctly. The stomach acid to release it, the intrinsic factor to carry it, the intestinal lining to absorb it. In most adults over 60, at least one part of that chain is compromised. Sublingual B12, a tablet or liquid that dissolves under your tongue, works completely differently. It absorbs directly through the mucous membrane tissue in your mouth and enters your bloodstream without going through the digestive system at all. It doesn't need stomach acid, it doesn't need intrinsic factor. For seniors with any degree of reduced digestive function, this one change alone often makes a more significant difference than switching forms or changing doses. The third problem is consistency and timing. B12 is not a stimulant you reach for when you feel tired and skip when you feel okay. It's a repair nutrient that your nervous system requires in steady, daily supply. Your nerve fibers are wrapped in a protective coating called myelin, and B12 plays a direct role in maintaining and rebuilding that myelin. Myelin repair is a slow, ongoing process. It doesn't happen in big bursts, it happens gradually every day. If you're skipping doses or stopping for a few weeks because symptoms improved and then restarting when they get bad again, you're interrupting that repair cycle repeatedly. Progress doesn't accumulate the way it needs to. For most people, taking B12 in the morning or early afternoon works best. It supports daytime energy without the mild stimulating effect that some people notice when they take it late in the evening. The fourth problem, and this one affects more people than realize it, is medication interference. Metformin, which is widely prescribed for blood sugar management, is well documented to reduce B12 absorption in the intestines. Proton pump inhibitors and H2 blockers, the acid-reducing medications used for reflux and heartburn, directly lower stomach acid levels, which you need to release B12. These are among the most commonly prescribed medications in adults over 60. If you're on either of them, this isn't a reason to panic or to stop your medication without talking to your doctor first. But it is a reason to be more intentional and more strategic about how you're supplementing B12, because the standard swallowed cyanocobalamin tablet is the approach least likely to overcome those barriers. Here's what a practical, effective B12 protocol actually looks like. Start by checking the form on your current supplement. If it says cyanocobalamin, replace it with methylcobalamin, or a product that combines methylcobalamin with adenosylcobalamin. Then look at how you're taking it. If you're swallowing a tablet, switch to a sublingual form that dissolves under the tongue and work on making it a consistent daily habit at the same time each morning. For dosage, most adults over 60 dealing with absorption challenges do well in the range of 1,000 to 2,000 micrograms daily. B12 is water-soluble, so excess is excreted safely, but discuss specifics with your doctor, especially if you have kidney concerns. Add methylfolate and active B6, since these two nutrients work in direct partnership with B12 for nerve repair and myelin maintenance. If either is low, they can blunt B12's effectiveness even when absorption is finally working properly. Have an honest conversation with your doctor about any medications you're taking that might be reducing your B12 absorption. Bring a list, ask the question directly, and finally change what you're tracking. Don't judge success only by a blood test number. Pay close attention to whether the tingling is less frequent, whether your balance is more reliable on stairs or uneven ground, whether your thinking is sharper and your energy more sustained through the day. These real-world functional improvements are the true measure of whether your protocol is actually working. I want to be honest with you about realistic expectations. B12 is genuinely powerful for many seniors when it's used correctly, but it's not a cure-all and it's not instant. If nerve damage has been accumulating for years, meaningful improvement is gradual, weeks to months, not days. And if your symptoms are worsening despite making these changes, that's a signal to see a physician and dig deeper, not to simply add more supplements. Other conditions like spinal compression or diabetes-related neuropathy can produce symptoms that look very similar to B12 insufficiency, and those need proper diagnosis. The goal here is informed, strategic supplementation alongside appropriate medical care, not a replacement for it. One more thing worth mentioning: the timing of when you start paying attention to all of this matters too. The nervous system has a real capacity to heal and repair when it's given consistent, correct support, but that capacity is greater earlier. If you address this at 65, the window for meaningful recovery is wider than at 75 with years of accumulated damage. I'm not saying this to create urgency for its own sake. I'm saying it because I've watched the difference in outcomes between patients who caught this early and patients who came in a decade later. Earlier genuinely is better here. Here's the truth that I want you to carry away from this video. Raymond didn't need a dramatic intervention. He wasn't missing some exotic treatment. He was taking B12 every day. That part he had right. But the form, the delivery method, and the medication interference had been silently working against him for years. 3 targeted changes, and his life measurably improved. I've seen that pattern repeat itself more times than I can count. If you've been taking B12 and not feeling better, I want you to ask yourself honestly, am I taking the right form, the right way, with the right supporting nutrients, and without anything quietly blocking it? Because the answer to that question might change everything. If today's video helped you understand something you didn't know before, here's what I want you to do right now. Leave a comment below: your age, where you're watching from, what form of B12 you're currently taking, and what's the first change you're going to make this week. These comments genuinely matter. They help other people in our community who are going through the same thing find real answers. Share this video with someone you care about who's over 60 and still dealing with fatigue, brain fog, or numbness. They may be making these same mistakes and have no idea this information exists. And if you're not subscribed yet, do it now. Every week I share strategies like this designed specifically for adults over 60, and you don't want to miss what's coming. Your nervous system is worth taking care of correctly, not just taking a supplement, taking it the right way. I'm Dr. Michael Kent. Thanks for watching, and I'll see you in the next one.